therapist, physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We
therapist.
are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, the name of the video is how a locked-in spine can help your back pain or sciatica.
Yes.
This video is a part of a series of videos on sciatica and back pain. If you want to see the entire series, go to our website, bobandbrad.com,
Right.
and go to the program section.
As well as all of these have a PDF printout. You can print out on your computer or your printer and take this with you for memory.
Like a handout.
Yep,
that
handout.
you can carry along with you. So today we're going to talk about a locked-in spine. So a locked-in spine. The spine was developed to be the strongest, actually, believe it or not, in what we call an S curve. So you have a curve, a slight curve in, a slight curve out, and a slight curve in.
All right, so behind the neck, around the shoulder blades, and the low
I
back.
guess this would be an S to you, Mike, right?
He's got to think about it.
Yeah, anyway, so one way or the other, it's an S.
Right.
And the bones were actually designed to kind of lock in place and be the strongest that way.
Right. There's little joints between each vertebra that have set joints, and they lock in at that point. And, you know, if you're lifting heavy weights, this is proper body mechanics. Get them all locked in so they're
And we'll show you in just a minute how to kind of give yourself a cue on that.
Right.
But what we don't want to see is your back in this rounded out, what we call the C position.
Right.
You got the two letters of the alphabet here. In this position, now you got stress on the discs.
Mhm.
Without a doubt, if you have especially have a herniated disc or a bulging disc, this
Right.
could make it worse. There's stress on the ligaments. Ligaments attach bone to bone. If you're in this position for a long time, you can actually stretch out the ligaments.
Sure.
The back becomes less stable.
Right.
The muscles can't work as well in this position either. They can't exert forces like they would like to.
Right.
So
This position is essentially the slouched poor posture
Right.
position.
Yeah.
He's exaggerating a little bit there, but
right, pretty
got
hard
it.
again. I just make the letter C.
yeah, that way you can remember it.
But I also want to. We used to show a demonstration of how it feels to stretch a ligament, Brad. And I remember that
yeah.
we used to just take a finger and pull back like that.
Yep.
And you're like, well, that doesn't feel too bad. Well, hold it for quite a while, and it starts to feel pain in there. If you kept doing it for a long time, and putting stress on, you could actually tear that ligament or get micro tears.
You're going to have a sore finger. Yeah, I learned it from a McKinsey course. I don't know.
Oh, did you?
It's actually in the book too.
Oh, it is.
Yeah.
So
You can't take credit for it, Bob.
that's stretching the ligament. Again, ligaments hold bone to bone.
Mm-hmm.
So you're in this position for a long time. It's like you're doing this to each level of the vertebrae, each bone. So we want to get that back in that straight position. Oh, well, I guess we're going to give one more demonstration, Brad.
Right. This actually, if your back is locked in that good posture position, it's kind of like.
Yeah, look how strong it is.
Right.
I can really
Now,
push on that.
The only thing different about this, it doesn't have the S curve. So
Right.
forget that. But when everything is locked in and where it's supposed to be strong, and if it does go off.
Yeah, if you start bending off, it's not as stable.
Yep.
The bones can't lock into like they should,
Right.
and they can become less stable.
Right.
Less can cause you problems. So
Pain.
with all the subsequent videos that we're going to show you, we're going to want to make sure that you do try to keep your back in the locked in position. Now, I want to show it to you standing. Brad, do you mind handing me a booyah stick? So really easy to do in a standing position. If you just take a stick, the booyah stick, and we put it, and there should be 3 points of contact. Contact on the head, mid-back, and low on the pelvis. Okay, so if you can imagine that, like I tell people, imagine that your back is in a cast when you're moving.
Yeah, switch hands once, Bob. Then they
Sure.
they can see the bottom too. So there. Yeah, that's probably a little more clear.
There we go. So one, you can picture a stick being like this in place if you're bending.
Mhm.
Now look, it's like your back is in a cast. All the movement is coming from the hips.
Right.
That's why we talk about hip hinging. And that's why it's so important that you develop that range of motion in your hips so that you can move like this. Now we actually do even squats like this, what we call posture squats, which we'll show you later. Because it trains your body then. Like whenever I want to pick something up now, the first thing I think is put my body, my back into a cast, keep it straight,
Yeah.
and bend from the hips.
Right.
And then you can bend like this, or you can even go like this.
Sure.
Alternate them.
Keep that back locked in, just like the the beginning of the video.
So it doesn't matter if you're getting off a chair, it doesn't matter what you're doing, you want to go ahead and keep that back in the locked in position. Thanks for watching.